As COVID cases surge, local officials have stressed the importance of taking an at-home test to minimize those long lines we've been seeing at testing sites. But how do they hold up in the age of Omicron? And are we actually using them correctly? Thank you so much for staying with us. I'm Vanessa Freeman.
And I'm Tamsa Vidal. There have also been a growing anecdotal accounts of people using the at-home nasal swabs as throat swabs and then getting a positive COVID test that they didn't get before. So joining us now to sort all this out is Dr. Shereef Elnahal, President and CEO of University Hospital in Newark. Dr. Elnahal, thank you so much for being with us today.
My pleasure, as always.
So let's jump into it. How well do the at-home tests that everyone's fighting to get detect the now dominant Omicron variant?
They detect them well enough, and that's an important point to make here. The worst thing we can do is reduce confidence that rapid antigen testing is effective in detecting, number one, that you're infected, and number two, that you could still possibly spread the virus. They are still effective. They're slightly less sensitive when it comes to Omicron than previous variants, but it's still a very useful tool and very informative tool for all sorts of purposes, especially for folks who've been exposed, unsure they have it, and are wondering if they could spread it to loved ones. And so I still do endorse their use.
If, Doctor, we would improve just well enough. Can we improve that accuracy of an at-home test by maybe taking a throat swab instead of just a nasal swab?
Well, what I'd encourage people to do is make sure they're using it according to the manufacturer's instructions. That's the data that's presented to the FDA. Unless the FDA comes out with guidance to say that you can use certain types of tests in other ways, such as throat swabs instead of nasal swabs, despite the labeling, I would really try to stick to the instructions on the box and in the inserts. Because that is how the tests have been validated, especially with the new tests coming out that were just approved by the FDA over the last couple of weeks. It's important to follow the instructions.
All right. I do know a lot of people, though, are getting the positive results with the tests when they're swabbing their throat. Is that correct, though? Why is that happening?
Well, in certain cases, you may end up detecting something from a different specimen or a different site. But again, unless the FDA is blessing that, I would not trust necessarily using it against the instructions. It's just too early to tell that that's a systematic thing. These are anecdotal reports that we're hearing, and it's, again, just important to use it as labeled.
Do we tend to see with Omicron compared to these other variations of COVID?
In terms of Omicron in general, it's certainly a less severe variant. We're seeing an increase in hospitalizations in our hospital, but a lower need for ICU care and ventilator care. And again, when it comes to these tests, it's slightly less sensitive in detecting infection, but certainly what you're feeling in terms of symptoms should dominate the day. And so I'd be skeptical of a negative antigen test if you have symptoms, but if you're asymptomatic, going with the test results and testing repeatedly if you can, all makes a lot of sense.
And what should somebody do if they do test positive with one of the at-home tests they bought? Do they need to report it, or do they try to find the next step, which would be the PCR test?
The most important thing to do if you test positive with an antigen test is to isolate. It's not necessary at this point to confirm a positive test with a PCR. PCR can detect a positive test where you have a false negative in an antigen test. So a lot of folks, if they're symptomatic, they get a negative antigen test, they'll follow it with a PCR. But if you have a positive antigen test, I would isolate for at least 5 days, follow the CDC guidelines, and really try not to expose vulnerable loved ones.
All right, Dr. Shereef Elnahal, thank you so much for your perspective and being with us today.
My pleasure.